Misha, Aisha, and welcome to another delivery from Rhythm Financial Mentors. Today, we're doing all things breast cancer awareness, and we have a special surprise for you today, a special interview from the head of oncology at the Free State, Dr. Alicia Sherriff. Welcome to our interview today, Doc.
Thank you very much, Aisha, and thank you for the invitation. It's much appreciated, and I hope that we can make a difference with this interview.
So good. Thank you so much for your time. So I'm not roaming alone. It's not just the two of us. We have our full staff. So say hi, everybody. Hi. All right. So we're just going to get into a few questions today,
Sure.
Doc. And I think the important thing is we are hearing about breast cancer every October. But why is it so important for us to be aware of breast cancer?
The main aim of October is to create a platform for awareness. We should all be aware of our health and breast cancer in itself right across the year. But October month is an opportunity for us to create meetings like this and interviews like this to emphasize that. And the reason is that in worldwide, breast cancer is the most common cancer among females, irrespective of ethnicity. And then in South Africa, it's our second most common, just after cervical cancer. But the impact that it has in the age group between 40 to 70 years, which is our time when we are economically viable, involved with family, being a mother, being a sister, being a wife. And that is the period where the greatest risk is. So it's important for us to emphasize that it is a curable disease, but the early diagnosis is essential.
So good. Thank you. So what would you say is the biggest misconception about breast cancer?
I think one of the things that you reflected on earlier is that males can also get breast cancer.
Yeah.
So for those of you who thought that you shouldn't be here, males also have breasts, then just not as prominent.
Yeah.
But males also can get breast cancer. And then the other thing is that it's not limited to just 40 to 70 years. So it can also happen earlier than that. And we see patients in their 20s and 30s. So it can also happen during pregnancy. And then the big thing is that it's not to say that it must be painful. People would come and say, but it wasn't a lump that caused me any discomfort, so I didn't think anything about it. And so anything in your body that changes is something that you need to reflect on and rather see a doctor to make sure that it isn't something ominous.
I think we'll start maybe with our gentlemen, seeing that we've just been taught about that. So I think we'll go over to Michael if you have a question for us.
Yeah. All right, doctor. What are the primary risk factors for developing breast cancer that women should be aware of?
So the big thing with breast cancer that increases the risk is exposure to estrogen, which is one of the female hormones. And if estrogen is not only made in our ovaries, but also in fatty tissue. So when you've got more fatty tissue, there's a greater concentration of estrogens in your body. So the earlier the younger you are when you started menstruating, and how older you are, you go into menopause, that increases your period into which you are exposed to estrogen. But when you add obesity to that, it increases the concentration of estrogen that your breasts have been exposed to. So that adds to that risk. And then previous radiation to the chest wall is also one of the risk factors. And then genetics. So a family history of breast cancer or prostate cancer is something that could indicate a higher risk or possibility of you also developing breast cancer.
Doctor, you spoke now about how obesity can be a factor that causes you to get breast cancer. So how can lifestyle choices impact breast cancer's risk?
So
So I think the big thing is moderation in everything you do, what you eat, and alcohol use and so forth, but then physical exercise. And physical exercise is something that we need to make ourselves used to already from childhood on, and continue beyond. 2 to 3 times a week, getting at least half an hour to an hour of exercise. It's not only good for preventing a breast cancer, but preventing hypertension, diabetes, all those things that, because we love our sculpture, is something that we unfortunately have higher risk for. So physical exercise definitely can assist in protecting us and just giving us a general improved health.
And then, Doctor, you mentioned earlier as well now that men can get breast cancer, and you also spoke about how it could also be genetically, something that goes down in your lineage. Is that the same for men, or does it affect more women when it comes to genetics? And then also on that, is the detection for it the same for a man than a woman?
Prostate cancer and breast cancer and ovarian cancer is a group of cancers that are all associated with a BRCA gene with increased risk. So if there's male family members who had prostate cancer at an earlier age, that could also be indication of risk of breast cancer and ovarian cancer. So they can walk alongside one another. Just remind me about your other question now again.
When it comes to detecting breast cancer for men and women.
Yeah, so because females have more volume in breast tissue, the role of mammograms, X-rays plays an important role, and then combined with that, sonars. So the earlier you start doing screening with mammograms, and the younger the age of a female, you usually combine it with a sonar as well, because the breast tissue tends to be more dense, and therefore the combination of the two examinations are required. For males, since there's less tissue to capture within an X-ray, it's usually more evaluated with a sonar. But because of the fact that there isn't an expectation and for older men to have a nodule in that area, it's also something that can be picked up very easily with examination and physical examination. I think the big thing for men is also that because there's not that expectation and general understanding that men can also get breast cancer, it's something that you feel more uncomfortable with to approach a doctor, or you do not realize always that that this could be a risk. For young men, going through adolescence, they might experience with change of hormones a thickening behind the nipple in that period. And that usually is not indicative of anything. But if a person is unsure, it's always good rather just to check with your doctor and make sure that there isn't anything ominous around it. But that's normal changes in the hormone profile. I think what's important that I didn't mention earlier, and for some of us around the table, it's a greater reality, is menopause. And that's when our estrogens is less. And as we said earlier, estrogen does play a role. So to protect our minds and bodies of that loss of estrogen, we go on hormone replacement therapy. So your gynae or general practitioner would first of all check if you've got a family history of breast cancer, and then the risk to start a person on hormone replacement therapy would have to be discussed, because unfortunately then you do have a higher risk to start the hormone replacement therapy. But for those of us who are on that, the screening process and being aware of an increased risk while using it is very important to take into account.
Hi, doctor. Can you explain how to perform a self-breast exam and how often should women do it?
It's important to we all know that we're quite cyclic, we as females. So you need to do the self-examination about a week after completing your menstrual cycle, your menstruation. It needs to be the same time every month. During menstruation, the breasts are more tender, more nodular, and it can be quite confusing what you feel on self-examination. So rather, just after you've completed your menstruation, to do the self-examination then. It's a process of visualizations, looking at yourself in the mirror and seeing that they look the same, they're symmetrical, and if there's any changes, recognizing it. And then you need to use, it's preferable to lie on your back, but turn slightly to the side, so that the breast tissue spreads across your chest wall. We all have different sizes. So for some of us who are smaller, it's less to spread, but if it's larger, then it's more comfortable if it's spread across your chest wall and not falling into the axilla. So when it's spread across your chest wall and you're lying slightly on your side, you use circular motions and you use the front part of your fingers. Don't use the tips of your fingers because that gives you a lesser yield because it's a much smaller surface that you are using. And then also you tend to push tissue out of the way. So when you use the front part of your fingers and you move it in a circular motion and you start at a specific point and you have to evaluate all the around of your breast as well as behind the nipple in those circular motions. And then you also move into your axilla to evaluate that process. So it's basically from just below the collarbone right to the bottom of your breast, and that you do once a month. Most people do it in the shower. We had one patient that said that they have always washed their body with the sponge, and suddenly the one day the sponge wasn't there and they used their hand and then they recognized, oh, I've got a lump. So it's important to have skin on skin in that process when you're evaluating, because otherwise you might pick up the lump a bit later.
Doctor, what should women expect during a clinical breast exam or a mammogram?
The clinical breast exam is from a general practitioner or a gynecologist that you visit would be more or less similar to the self-examination that I've just explained. The addition then would be the knowledge that the doctor has when they're examining you. And then regarding a mammogram is an X-ray that's done of the breast. And it's when I explain it now to you, it's going to sound very uncomfortable, but technology is of such that it is less painful probably and less uncomfortable than what it was in the past. But it still is sounds really hectic. So basically what happens is that when the breast tissue is placed between two flat objects, and then an X-ray is done of the breast, and it's done from an upper and lower visualization, and then also from an oblique direction to evaluate the whole of the breast up to the chest wall. Sorry, shouldn't touch the microphone, apologies. Up to the chest wall. And you also, within that X-ray of the breast, want to capture the lymph nodes under the arm. And this X-ray is usually combined with a sonar evaluation. If you see something on this mammogram X-ray, that you can confirm with further visualization with a sonar.
Okay, so doctor, what resources or support are there for women with breast cancer?
it's a multidisciplinary team that would approach a person with breast cancer, and the patient and their family is the center of that multidisciplinary team, and is just as much part of the discussion and team as every other member. And when we have this discussions and support of the patient's needs and the family's needs are an essential component of that discussion. But furthermore, part of this team is the surgeon, and then the oncologist. We also have a psychologist and your palliative care doctor and nurse to support the patient and their families. And then a social worker, because when a person is diagnosed with cancer, irrespective of the type of cancer, it's not just a physical experience and anxiety and of, the loss of your physical abilities, but also the psychosocial components of it, the impact on the family and your ability to work or when you have to go for treatments and such, and then a spiritual component. And all of those facets needs to be addressed and supported by this team. So there's also a navigator to guide you and remind you of where you need to be when. And it's important when that discussion happens that you as the patient are not alone there, but that you do have family support, because it's always good to have more than one pair of ears listening and helping you and remind you about the discussions that happened.
Doctor, I would just like to know, how could friends and family best support someone going through breast cancer treatment?
I think the big thing is that not to disappear. It's a very difficult discussions, and it creates anxiety for you because you're always afraid that you say the wrong thing. So through many platforms, and we can just let the person know that we're there for them and be open for communication, be able to listen. Sometimes we feel we have to fill quiet spaces with saying something, and then we tend to compare either your own experience or another person who had a cancer's experience with what that person is going through. And we must be very careful to compare, because each person's experience and cancer is different. And so that also needs to be respected. But I think one of the most important things is to let the person know that you're there to listen and that they are not alone in this process, and help them realize that they need to share their emotions when they're ready, because by speaking, you also will know how and what their needs are and how to support them.
Hi, Doctor. How can social media play a role in raising awareness and educating the public about breast cancer?
It's basically what we're going to do today, is that now in a half an hour's time, I had the opportunity to speak with 10, 12 people around the table. But having this recorded and putting it on social media, we reach so many more people. And it also creates a platform of further communication, because people get the opportunity to ask their questions then, or reach out to their own doctor when they pick up that something is different or wrong. So I think it gives us the opportunity to reach much wider than just our one-on-one discussions. But I hope that for most of us, it would not just stay on social media, but because this type of face-to-face discussions is just as important.
What final advice do you have for women regarding breast cancer awareness and taking charge of their health?
That initial diagnosis is quite overwhelming, because you've got expectations and I think it's first of all very important to realize that the diagnosis of cancer and the word in itself doesn't mean death, and that early diagnosis and communication and openness about your own health and your own body is essential to make sure that we are able to make that diagnosis early on. And then if a diagnosis is made, to be open in your discussions also with your family members. We have to acknowledge to ourselves and our partner and our children that our bodies are going to change, but that doesn't change you. And we have to communicate our needs right through this process that we're going through, so that your family and children would know how to support you best. We usually advise, because the chemotherapy that is given will create hair loss and will have its side effects, but the majority of the side effects there are methods of treating it or supporting you through that process. The one thing that cannot be prevented is the hair loss. So we usually advise our patients, when they see the hair starting falling out, to rather cut it short or cut it off completely, because it's quite emotional and traumatic, that process of the hair loss, and rather plan for it and decide, am I the person who wears a doek or a scarf over my head, or am I the person who wears enormous earrings and walk with my head open and have a perfect head? Or are you the type of person that would prefer a wig? So, and plan for that. And by doing that, you're empowering yourself. So empowerment is the big thing, because when you get diagnosed with any illness, not just cancer, it feels as if your choices and your power is taken away from you, and that future that you had planned for yourself is threatened. So by creating things like a wig, you take back some of the power, and you create an environment for yourself where you can say, this is how I would like to manage what life has brought across my table. And spirituality through this process is very important, and knowing where you find your strength and your future vision in this process.
So thank you so much, Dr. Sherriff. We really appreciate this. I think it was very insightful. We hear about these campaigns, and I think the roundtable, this just made it more real. And I hope that you on the other side of the screen have learned something, but it goes beyond just watching a video, that it will become your real life and you will take action to become aware of breast cancer, but do something about it. From your go at the name to claim, AISHA. Until we meet again, it's been good. Rhythm Financial Mentors.